وسهلا بكل الذين ينضموا للاستماع إلى راديو بلدي أول راديو عربي أمريكي ويعنى بقضايا العرب في المهجر. برامجنا في راديو بلدي كل يوم جمعة من 8 وحتى 9 صباحا مع ليلى الحسيني في بث حي ومباشر وعبر wnzk راديو 690 AM. صباح الخير بلدي، صباح الخير لكل مستمعينا.
Welcome to Radio Baladi, the first Arab, Middle Eastern, and American simulcast radio show. Radio Baladi is broadcast every Friday morning on wnzk 690 AM from 8 until 9 Eastern Time on Good Morning Michigan with Layla Al-Husseini. Our call-in number 248-557-3300. And now, stay tuned for the best radio talk show on Arab and American issues with your host, Layla Al-Husseini.
Good morning and welcome to Radio Baladi, US Arab Radio. Today is Friday, January 27, 2017. My name is Khalil Hachem. I'm the executive editor of wdmv.com, the fastest growing multimedia news and information network. I'm your host today. The weather is 31 degrees and we could see some rain mixed with snow, and it's going to be a cold day, so be careful on the road and stay warm. Thank you again for being with us. The number here is 248-557-3300. We would love to hear from you. Today's topic, we have an exciting program for you today, rather, and we will be discussing health care. As you well know, President Trump, last week we were talking President-elect, this week we say President Trump, in his first week in office, he issued an executive to repeal and replace the Obamacare. As you well know, the Obamacare benefits a lot of people. We may not like it, but it does benefit a lot of people. The fear is what happens if it is repealed, how would it affect people? Even though we cannot speculate on things that we don't know what they are, but we want to learn more about the Obamacare, about the benefits, and possibly about how can we get those benefits. Good morning. We have our guest. Is that correct? Good morning.
Good morning.
Hello. How are you today?
Good. How are you?
Wonderful. Thank you for being with us. Could you please tell us a little bit about you and who you are, what you do, and about Access as well?
Yeah, sure. So my name is Shama Zagela. I am a public health coordinator at Access.
Okay.
We are a nonprofit Arab American organization based out of Dearborn, Michigan. We provide a large variety of health and human services. I specifically work at our Community Health and Research Center, and I oversee our Navigator program, which is a program funded through the government to help individuals get enrolled in marketplace plans through the Affordable Care Act, as well as Medicaid through our expanded Medicaid due to the Affordable Care Act. So we have about 7 different navigators on staff, which are there to help anyone in the community that are willing and would like to enroll into one of these insurance plans.
So these navigators, basically, if I need health care, I can go sit down and talk to that person, and that person will try to find me a health care plan, or at least start the progress. Is that correct?
Yeah, exactly. So I don't know about yourself, but healthcare is very complex, and even me with an advanced degree, I've had some issues myself trying to enroll. So these are individuals who have been trained and gone through lots of different backgrounds and looking into different plans and whatnot, and they are trained to help individuals that come in and actually they fill out the application. So there's an application that you need to fill out through the Marketplace website, and then they help you go through that whole thing. There's a lot of different information that needs to be put in, so they help you kind of walk through that entire process, and then once your results get spit out, they will then help you navigate towards which plan you would like to select, what your needs are, and how we can best pick a plan that's suited for you. And that's through either the marketplace, which is through the ACA, and if you don't qualify for that and you're making a certain amount of, your income is less than the threshold, then we can have you then apply for our expanded Michigan Medicaid. So then we can also get you set up with that.
Okay. And how many people roughly did you help, or you estimate we have in our community enrolled in that?
So
through you guys?
Roughly, this is, of course, we've been doing this for 4 years. This is our 4th year doing this. And throughout those 4 years, roughly, I'm speaking again, we've assisted about over 28,000 individuals.
That's a pretty good number.
Yes, it is.
Yeah. And, what are some of the benefits? I mean, how are we benefiting from Obamacare that we didn't benefit before?
Yeah, so, previous to the Affordable Care Act and, its components, there were health insurance plans that didn't necessarily have the essential health benefits. And now, if you go and get a plan through the marketplace, they have to cover at least I can give you a few of the examples of the following service. They have to cover emergency services, hospitalizations, prescription drugs, preventative and wellness services, laboratory services, pediatric services, pregnancy, maternity, newborn care, mental health, substance abuse disorder services. All of these services are mandatory and need to be included in any health insurance plan that you select. Previously, this wasn't the case. And also, the Affordable Care Act does mandate that, you can allow, say, for example, if you have a child and they are at the age of 22, they can still stay under your health insurance plan until they're 26 years old, which was a big issue before because as soon as your child was an adult, either 18 or 21, they would get kicked off. So that's a great thing. And then another big issue was health insurance plans were able to deny you if you had any pre-existing conditions, which is also something that the Affordable Care Act took away. So even if you had any pre-existing conditions, you would not be turned away from any insurance company.
Absolutely. Have you, we don't want to speculate on what if because we still don't know what's really going on, but we know there are going to be some changes. And have you gotten any concerns, people kind of concerned about, am I going to lose my health care? I'm going to lose my benefits, things like that?
With the current political climate and things changing very rapidly, it's natural for some individuals, actually the community as a whole, to be a little nervous about what will be in the upcoming future. And, we have had some calls of individuals, especially because we have the deadline coming up for January 31st, if, they should be paying their premiums, if this, if this whole ACA is going away. And as of now, we just try to reassure our clients that, we don't know anything yet, and it's very, very important that you do pay those premiums because soon as you don't pay them, you get kicked off of your health insurance. So, it's very important that they continue to do that as we know, nothing is clear right now. It can be very scary for some of our clients if, they have the potential of losing their health insurance, especially if they're on, Medicaid. But as a community organization, our duty is to serve our clients and do the best that we can do. So right now we're just continuing to do the work that we have been given and continue to get people enrolled into their plans.
Sure. And I know this is only an executive order by President Trump. Did you, who's your relationship with? What department at the federal government, at the federal level, you deal with?
So we actually are a program that's funded through the Centers for Medicare and Medicaid, so CMS, and they are our grantor, I guess, and we're the grantees from there.
Sure. Did they send you anything? Did they tell you anything, different than what you've been doing?
No, we have been, told to continue doing our work. We have not been told anything. We haven't been given any news. And so, like I said, just continuing to do the work that we've been doing for the past 4 years.
Sure. What's your recommendation for our community members to do? Those who haven't paid, those who haven't enrolled, all of these kind of things.
I think this is a wonderful benefit for every individual, and health is a human right, and it's not a privilege. So I think it's very important that we take advantage of the Affordable Care Act and get enrolled into a health insurance plan. We have some fantastic individuals out there, at Access and other locations throughout Michigan, and not just in Michigan, but all over the United States, where you can find navigators to help you get enrolled into a plan. So please take advantage of this. The deadline is coming up very, very soon. It's actually January 31st. So I would highly recommend that you look out into your local areas and see if there's anyone that can help you get enrolled. And if you're already enrolled, to make sure that you have, completed the proper work to get re-enrolled from your plan previously. And if there's obviously any questions, navigators are out there to help you. This is a free service that is provided in the community by the government. So please take advantage of that.
Yeah. We have a question here. It was sent to me by email saying that if you have been enrolled through the what do you call it, the expanded Medicaid? Yeah, no, the expanded Medicaid. Yeah.
Okay.
And do you have to re-enroll, or like if you received a letter several months ago telling you that you're covered for next year, whatever it is, so you're already set? Is that correct?
So I think that everyone is, it's very different. Each case is kind of different. But if they have any hesitation on if they need to get re-enrolled, I would definitely go out and seek navigator services. And the nice thing about Medicaid is that there isn't technically a deadline for Medicaid, but I would still go see a navigator to make sure that their plan is still a Medicaid plan, because things do shift around year to year.
Absolutely. You know what? It sounds like it. Even if there are going to be some changes from, following the issue nationally, even if there are going to be some changes, there will be some remnants of or part of it, or most part of it, the Obamacare will continue to exist. So it would make a lot of sense for our community those who are not enrolled, to be enrolled, so they can, now and then they can reap those benefits. Is that correct?
Like I said, I can't really comment on what's going to happen in the future, but, as of now, we're not sure if, the repeal will happen, if it won't happen, what components. I'm just as much in the dark as all of you are.
Sure.
So, I do agree with you. I think that it's really important that we do take the benefit while we have it now, as everything is so uncertain. So, I definitely do agree that you should you should definitely get enrolled into a plan and get that insurance, even if the future is uncertain.
Absolutely. And these are really great benefits, and I just can't stress how helpful the navigators, because, we did a show on it a couple of years ago, and I went ahead and did it myself just to see, so we can talk about it. And I just found the person that I worked with your staff, it was unbelievably helpful, and he took the time to, create everything that needed to happen to initiate the whole process.
Definitely.
So how can we reach you, and what are the locations, and and locally in Dearborn and other areas?
Yeah. So the best way to reach us is so we have two main offices, one in Dearborn and one in Sterling Heights. So we're both in Wayne and Macomb County. And the best way to probably reach us is through our website, and we have a website called www.accesshealthcaremichigan.org. If you go on there, you can find all of the phone numbers. You can also schedule appointments. I highly suggest, with the deadline coming up so soon, that you would actually set up an appointment, because we do take walk-ins. and we will be open on the weekend. So if anyone is interested and can't get time off during the week, please do note that our location on Maple in Dearborn will be open from 10 a.m. to 3 p.m. on Saturday and Sunday, and our location in Sterling Heights, which is on 14 and Bryan, will be open on Saturday from 10 to 3 and Sunday from 11 to 3. So if there's anyone that needs to get these services, needs to get enrolled, please do come into our office. And then, like I said, we're open 9 to 5 throughout the week as well.
Well, thank you so much. I really want to thank you for being with us. This is valuable information, and I hope that more and more of our community members take advantage of those services. Thank you for being with us.
Thank you so much for having me.
Absolutely. Please stay tuned. We're going to take a short break. We'll be right back.
A car accident can change your life in an instant. As a result of a car accident, you may become unemployed. As a result of a car accident, you may need a lot of medical treatment. People think that insurance companies are on their side. Why? Because they're giving them one or two benefits. Are they giving them all the benefits they deserve? How would one know unless you consult with an attorney? Call the law offices of Jumana Kiruz at 248-557-3645. 248-557-3645.
It's never too early to get your child on the right track. From their first words to first grade, Dreamy Children's Center in Troy works closely with parents to provide an experience that goes beyond early education. The highly qualified and experienced staff use a variety of programs that can help nurture important personality traits like responsibility, independence, problem solving, motivation, and respect. They also have educational programs ranging from preschooling for infants, toddlers, transitional toddlers, and pre-K to Montessori-approved programs and bilingual curriculums for young children. They're open from 6 a.m. to 6:30 p.m., can provide breakfast, lunch, and dinner with snacks in between, and can also arrange for after-school pickup. Dreamy Children's Center in Troy is located at 37373 DeQuinder, just above 16 Mile Road, and can be found on Facebook at Dreamy Children's Center. Ask about the free preschool program. Call today, 248-680-9170, 248-680-9170.
Are you going to start a restaurant or a grocery store soon? Do you need floor plans and designs? Call Naji Abood at 734-744-9796. Do you want to buy kitchen and restaurant equipment at discount prices? Call Naji Abood now, 734-744-9796. New Concept Products and Design, the trademark of kitchen equipment. 5% discount on all purchases of $75,000 or more. New Concept Products and Design, new location, 31185 Schoolcraft in Livonia. Learn more at www.newconceptproducts.com. Call Naji Abood, 734-744-9796. When you're looking for the best in optical care, Dr. Imad Nakash is your doctor to see. With years of experience and thousands of successful procedures performed, you can trust your eyes to Dr. Imad Nakash. See Dr. Imad Nakash and his professional staff for your eye care needs. There's 2 locations to serve you. In Hazel Park, call 248-336-3937. 248-336-3937. In Rochester Hills, call 248-299-3937. That's 248-299-3937.
Welcome back, and thank you for being with us on Radio Baladi, US Arab Radio. This is Khalil Hachem, your host, and we're going to continue the discussion about health care and what are the benefits, what could happen, and what triggered this program is the recent executive order by President Trump to repeal and replace. While we cannot really talk about what could happen because it will be speculation, we are talking about what are the benefits, how can we take advantage of it, and, what is the Obamacare that's been going on for about 4 years. And joining us this morning, Karin Gyger and Andrea Miller. Good morning.
Good morning.
How are you today? Thank you so much for being with us. And did I pronounce your names correctly?
You sure did. Yep. Thank you for having us on your show.
Absolutely. Thank you so much. Before we start, tell us a little bit about you and your department and what you do, please.
Sure. The Department of Insurance and Financial Services is the state regulator of all of the insurance and financial industry here in the state of Michigan.
And this is Andrea talking, is that right?
No, this is Karen.
Karen. Okay, Karen. Please, go ahead.
So we are the regulator of every insurance product, not just health insurance, and again, and also financial products. So auto insurance, homeowners, mortgages, credit unions, banks, that sort of thing.
Okay. So our focus today is healthcare, and tell us a little bit more about, it started about 4 years ago. How many people do we have? The different programs, different benefits, and then we'll continue with other aspects as well.
So the Affordable Care Act created the health insurance marketplace, which is here in the state of Michigan. It is a federally run program. It is a place where Michigan citizens can shop for and compare different health insurance products. Here in Michigan, we have about 600,000 people who 300,000 people who have utilized the marketplace. The second major piece of the Affordable Care Act is here in Michigan is the Medicaid expansion, which is known as the Healthy Michigan Plan. And we have about 600,000 Michigan residents who are utilizing that. So collectively, here in the state of Michigan, we've got about 1 million citizens who are utilizing one aspect or the other of these programs.
What's the difference between the two?
The marketplace is a place basically where you can purchase a private commercial health insurance product. You actually are the purchaser of a product, and once you purchase that product, it is an insurance contract between you and the health insurance company, and it acts just like any other health insurance product. You've got, co-pays, deductibles, that sort of thing. The Healthy Michigan Plan is an extension of the Medicaid program. The majority of that cost is picked up by the federal government, some by the state. And while it is also coverage, it's not a commercial insurance product.
What do you have to do to qualify for the Healthy Michigan Plan?
For Healthy Michigan Plan, you need to be a Michigan resident between the ages of 19 and 64, and you need to have an income of below 133% of the federal poverty level, which for an individual that is about $16,000 a year.
Family for?
Family for, I believe it's about $30,000.
Okay. And when someone goes through a navigator or any other outlets, they determine that your income is such and such, then you refer to DHS?
So when you use a navigator, or if you apply for Healthy Michigan Plan, or if you apply at healthcare.gov, there's basically no wrong door. Your application, they're going to look at what your income is, and they're going to determine, okay, we think you're eligible for the Healthy Michigan Plan, and they're going to route you to, state DHS. If your income is above that eligibility, then they're going to tell you what sort of subsidy or cost-sharing reduction you might be eligible for that would reduce the cost of purchasing health insurance in the health insurance marketplace. The tax subsidy is available for folks who are basically between 100% and 400% of the federal poverty level, and that is a much greater spread of folks. And almost everybody who applies through the marketplace, in fact, in Michigan, the number is 77.7% of folks are eligible for some form of tax credit to actually lower the cost of their marketplace coverage.
Okay. And the best way to do this if somebody qualifies is, again, to call DHS directly or go through the marketplace?
A navigator is if you really like that one-on-one service, a navigator can help you apply for either program. And again, it's one application that can route you either way. That to me is the best option. You get that one-on-one experience. They help you do the application, and they help you compare the plans. Because, if you're buying a marketplace plan, the application's only half the battle. Once you find out what you're eligible for, then is the time where you can look at, okay, there's bronze plans, silver plans, gold plans. What plan do you want? Which doctors are in which plan? If you have a doctor that you want to make sure that is in your network. If you take certain prescription drugs, you want to make sure you buy a plan that has that coverage. A navigator can help you one-on-one compare those plans.
Sure. What's some of the good benefits that have come out of the Obamacare?
Well, we certainly here in Michigan see the number of uninsured drop. We have more folks who are covered. Another issue that here at the department we saw a lot of prior to the Affordable Care Act was individuals who had a pre-existing medical condition oftentimes could not purchase. They would be denied coverage.
And the deadline to enroll is January 31st, is that correct?
That's correct, and it's important for citizens to know that that's not just for the health insurance marketplace. That's if you want to purchase coverage yourself, either inside or outside of the marketplace. The deadline to apply is January 31st. However, Healthy Michigan Plan they take applications year-round, but if you need to buy an insurance product, the deadline is January 31st.
January 31st. And to enroll as well?
Correct.
Okay. And if, we had an email earlier, if someone is part of the Healthy Michigan Plan and received a letter from DHS saying that, you're fine till 2017, do they have to reapply or they have to wait for their caseworker to renew that?
I think they need to check with their caseworker on that. I'm not sure what exactly their letter says. They should call their caseworker to confirm.
To confirm that. And again, we don't want to speculate about what would happen or anything like it because we don't know what's going to happen. You did not receive anything from the federal government in regard to, any changes or anything like that. So we will continue working business as usual.
Yeah, Khalil, that's a very important message we would like to communicate. Insurers have signed contracts to provide coverage through 2017. If there are changes made mid-year to the law, they may or they may not affect plan year 2017. So as changes occur, I believe consumers will have options as the information is coming out. As for now, it's business as usual. In fact, our office is already working on preparing for plan year 2018, and so are insurance companies here in Michigan.
Sure. So we'd like our community to really take advantage of this, and this is my take on it, even if going to be any changes, part from what we've seen and heard is part of the Obamacare will remain. And it's important for those who don't have or need to renew to do that before the January 31st deadline. Would that be accurate to say?
Yes. Mm-hmm.
Yeah, sounds good. I really want to thank you. Is there anything I haven't asked you that's important for people to know?
We are available Monday through Friday, 8 a.m. to 5 p.m. We have live people who answer our phones. If you ever have questions about health insurance or any other insurance product, give us a call. Our number is 877-999-6442. We can help you talk through your options, get you to the right place. Also, if you ever have a problem with a health insurance product or any other insurance product, we take complaints with those too. We can sometimes help you get claims paid or get answers to questions that you're having difficulty, working with your insurance company to get. We also, our website is michigan.gov/DIFS, DIFS, and we have lots of information on the website as well.
Yeah, you brought up a good point, which is if someone has any complaints, how does that work?
We take complaints. We have an online complaint form. We have a paper complaint form, and we have analysts who are assigned those complaints. We are bound by the terms of both state and federal law and what the conditions are within your insurance contract. But A lot of times errors occur, billing errors especially, and we open a complaint, ask the insurance company to respond, and oftentimes we recover money on behalf of Michigan citizens. So, we're happy to investigate any concerns you have with your insurance.
Is it mainly complaint about, insurance-related, money-related, and could they be also complaints about coverage?
Yes. If you have questions about, like if you're having difficulty getting in to see a specialist, if you have a prescription drug that they're not covering, these are things that we take too. We also have a formal appeals process. So if you ever are denied a service or a treatment, we do have a formal appeals process that an individual can go through as well. So we have both complaints and appeals.
That includes being denied by DHS. Is that correct?
No. DHS has their own appeals process. This is just for your private insurance coverage, commercial insurance coverage.
Okay. It's part of the regulations that you do. Is that correct?
Correct. Right.
Okay. I just want to ask you one last time to repeat the contact information and how can people get help.
Right. You can call the Department of Insurance and Financial Services at 877-999-6442, and we have individuals answering the phone Monday through Friday between the hours of 8 a.m. and 5 p.m. And our website is michigan.gov/DIFS, DIFS.
Before I let you go, and I'm not sure if this is part of your area or not, are there going to be any changes in regard to the no-fault insurance, the auto insurance?
Our director is very interested in the issue and very committed to working with the legislature in the coming year to see if we can help bring those prices down for Michigan citizens.
Sure. What is the process right now, the progress, rather?
Well, the legislature just opened up a new term.
Okay.
So, all the ideas basically come out of the legislature. Sure. And we, as a department, weigh in and comment on, sort of advise and comment on what the legislature is doing. But our director here at the department is very concerned about the cost of auto insurance here in Michigan and is committed to working with our legislature to coming up with solutions.
I want to thank you so much for being with us, Karin Gyger of from the state and the Department of Insurance and Labor?
Insurance and Financial Services.
Insurance and Financial Services. I want to thank you so much for being with us. Thank you, Andrea Miller, for arranging for the interview, and have a wonderful, wonderful weekend.
Thank you, Khalil.
Thank you. Please stay tuned. We'll be right back.
مع أقوى الأفلام مدبلجة.
يمكنكم مشاهدة قناتي في ألوان في أفلام على ديش نتورك أو على سلينك بلاتفورم.
الدنيا مسرح كبير على زي أفلام، لذا عليك أن تصنع قصتك بنفسك.
From India.
زي ألوان ستبهركم بكل حصري وجديد.
زي أفلام دخلت بيوت جميع عشاق بوليوود، وزي ألوان لونت عالم بوليوود. لا تفوتوا مشاهدة أجمل الأفلام على زي أفلام وزي ألوان.
يمكنكم مشاهدة قناتي زي ألوان زي أفلام على ديش نتورك أو على سلينك بلاتفورم.
Life for Relief and Development is a non-profit charity that has been providing humanitarian aid and development to people and communities regardless of race, color, religion, or cultural background for over 22 years. When disaster occurs here or around the world, Life rushes to provide food, medical aid, and shelter to those in need. Life also has development projects to provide medical relief, water purification, educational programs, relief for orphans, and much more. Your help and support can greatly improve these efforts. All donations are tax deductible. For more information, please visit our website at lifeusa.org or call 248-424-7493. That's lifeusa.org, 248-424-7493.
Ziyad brand. Quality products from our family to yours.
Ziyad Brothers Importing offers the finest quality products, including brands like Sultan, Kraft, Nestle, Hook, Rico Picon, Donna, and many more. Ask your retailer to carry these fine products because you deserve the very best. For more information, visit our website at www.ziyad.com. That's www.ziyad.com. Ziyad, quality products from our family to yours.
Welcome back and thank you for being with us. This is Khalil Hachem with the Radio Baladi. The number here is 248-557-3300, and we were talking to Karin Gyger from the Department of Insurance with the state, and also earlier we were talking to the Access representative. And the conclusion of this discussion has been Obamacare right now is on the books. It will continue through 2017 most likely. So if you need to register or re-register, do not delay it. The deadline is January 31st. Please do so without any delays because there are a lot of benefits to it. Don't miss on that. Good morning, Jerry.
To you, Mr. Khalil Hachem. Good morning and Happy New Year, sir.
Same to you.
And thank you for taking my call.
What's on your
Mr.
mind?
Mr. Khalil, I wish if Miss Karin, she didn't leave, Miss Karin Gyger, because I was trying to address a very important question to her. You remember, Mr. Khalil Hachem, our former president, Mr. Barack Hussein Obama, he was the founder father of Obama Healthcare. And I was trying to address a question to Karin. You know, Mr. Khalil, you are a businessman, you are in real estate. Michigander and American in general, they suffer a lot of damage and negativity from the rate that the auto insurance been charged. And you know the state of Michigan, Mr. Khalil, consider second or the third state on a higher rate. And which that create, Mr. Khalil Hachem, a lot of people, they are driving on the road, on the street, without insurance. And you know that. Well, I was trying to ask a question to Ms. Karin, and I wish if she could hear me. Former President Obama create the health care, and they name it by his name. What about our new president, Mr. Donald John Trump? If he is real, consider he care about his citizen, how about if he create an insurance, they call it a Trump auto insurance. Trump auto insurance to help millions of Americans who they are suffering from the greedy of the auto insurance company. You know, an example, Mr. Khalil Hachem, I am one of the people who suffer. And why? I have a great, clean driving record. But you know, Mr. Khalil Hachem, what stand against me? I was a businessman for 25 years. And you know, business is up and down. So when I filed my business, it hurt my score. And you know, Mr. Khalil Hachem, they treat my insurance rate with the score. Before I used to have 800 plus. So when I came down to 600, the insurance agency say, I have to raise your rate. Don't you think this is not fair? This is ridiculous.
And this is hypocrite. This is really a question. I mean, Karin she's not with us anymore. The interview ended at 8:30. First, second, there's a difference between those who execute the law and those who make the law. And this question is not really for Karin. This question is for the legislators. You know, you need to find out who represents you in Lansing and in Congress in Washington and address that issue to them because they're the one right now are discussing the laws. The state legislators make the laws.
Mr. Khalil Hachem, for interrupt you. Did the idea make sense to you?
Yeah. I mean, we need a better auto insurance for everyone to serve the residents and not serve the insurance companies. And this is what we have right now, you know. And a lot of people can argue for the no-fault insurance, but also it is a system that, you know, and a lot of people could argue against it. So this is a perfect time because the legislators in Lansing are discussing it, and they're going to make laws. This is the perfect time for Jerry and everyone else to get in touch with, to get in touch
state
with
representatives or congressmen.
Exactly, and talk to them and do something about it.
And this has to be done, Mr. Khalil Hachem. Excuse me, so many people, not just Jerry or Khalil.
Absolutely.
Has to be a group.
Absolutely.
Absolutely.
But let's start with ourselves. Everyone start with themselves. We don't want to say, oh, let everybody else do it. Let's start with ourselves, and everyone start with themselves and reach out to their legislator. Let them know what they're suffering through, and let them know what's going on.
Exactly. Mr. Khalil, you remember in Arabic we have a very famous say, بداية الغيث قطرة.
Yeah, بلا شك.
بداية الغيث قطرة.
Yeah.
So the first
Thank you, Jerry. I appreciate your call. And
Mr. Khalil Hachem, thank you for taking my call.
Absolutely.
And thank you for your show. And God bless you and Happy New Year.
Thank you so much. We're waiting to hear from Dr. Suwan. Is Dr. Suwan with us this morning? Good morning, Dr. Suwan.
Yeah, hello, Khalil.
We're waiting to reconnect with Dr. Suwan. She's calling us from Chicago. She will be with us shortly. And again, Jerry brings up a very important question, and that is the health care. He added to it the auto insurance, and Michigan has one of the highest auto insurance in the state, and it's really unfair. And the issue that he brought up is, why do people have to pay more if something happens to them and their credit score changes? And that's a very valid, and I don't understand what's the connection between personal credit and buying auto insurance. And to be honest with you, unless you buy full coverage auto insurance, the liability, for example, if you have liability, it doesn't really do you any good. You're just paying a ticket to drive a car. It's not really doing you any good at all, unless you don't have medical, and then you have to go to the hospital. Dr. Suwan, are you with us again?
Yes, I am.
Wonderful. Thank you so much for joining us, and we've covered quite a bit of issues, and early on, from healthcare to auto insurance to different insurance, and now we want to talk about a better insurance, which is mental. Which is, how can we deal with stress? How can we, and recently you've gone to the Hajj, and I'm curious to know, a few months later, what benefits, psychological and faith benefits that you've gotten from that trip.
Yeah, I would say that it was really the most amazing trip, and I learned so much after that. Khalil, I learned to be strong when I feel like crying. I learned to be grateful when I feel lost, and positive when totally surrounded by negativity, and hopeful even if I have every reason to be doubt, and peaceful when I want to be angry. I think that this is something extremely important, and I would say that nothing, actually, no situation should control my life. I would say that when I went to Hajj, I learned that, our life, as long as it could be, it will never last, and we have actually to do more for the afterlife. And so I would say that, I learned how to deal with stress in a better way, if you will. And as you know, the best way of dealing with stress is, to be faithful and to have faith in God, and at the same time, to be patient and to pray. This is the most important tools to deal with stress. And also, I learned that major stresses should actually become minor if we believe in God, and if we are faithful.
So, what would be? How would you apply these benefits? A lot of people can talk about benefits, but how do we apply them?
I would say that, for the normal person, I mean, stress is a normal part of life, and I would say it's inevitable. It walks in and out of our lives on a regular basis. There isn't anybody who did not experience stress. I think that the most important thing, Khalil, is to find out what is the reason of stress or where the stress is coming from. Do you agree with me?
Yes, absolutely, absolutely. What we're going to do, we're going to take a short break. We'll be right back.
معاكم الشيف أحمد إبراهيم من سوبر ماركت زمزم المطعم. عندنا أكلات كتير عراقية ومصرية ولبنانية زي جلابة وتشيكن طاووق وكباب ومسقعة، وأحيانا بنعمل الملوخية والكشري وفراخ مشوية، وكل اللي انتوا عايزينه موجود عندنا. اتفضلوا زورونا في محلات زمزم.
احييكم من اسواق زمزم، ويوجد عندنا تخفيضات كثيرة على الاسواق وعلى الجروسري وعلى الخضار وعلى اللحوم. عندنا لحوم حلال، والمطعم كله لحوم حلال كمان. واتمنى لكم السلامة والدوام، وزورونا دايما، هتلاقوا تخفيضات كثيرة وكبيرة وتجدوا كل ما يسركم.
استوديو زرياب بإدارة حسن حامد في ستورمينغ هايتس يحييكم ويقدم لكم خدماته بالصوت والصورة، تسجيل، تصوير، مونتاج، فيديو كليب، إعلانات، كوميرشالز، دوكيومنتري، أفلام وثائقية للترويج لبضائعكم ومحلاتكم وشركاتكم، برامج تلفزيونية وإذاعية. استوديو زرياب وبتقنية عالية بإدارة حسن حامد 313-945-8860 313-945-8860 أو 248-761-5787. استوديو زرياب، الصوت والصورة اختصاصنا.
قشة ميديترينيان ماركت بإدارة سهر قشات وأولاده يرحبون بالجالية العربية والكلدانية. جميع أنواع المواد الغذائية، البان طازجة، الكرزات والبهارات الطازجة داخل الأسواق. مطعم ميديترينيان شيش كباب يقدم يوميا جميع أنواع الكباب، المقبلات العربية العراقية وصواني الكامبو المميزة. تفتح الأسواق من 8 إلى 9 مساء من الاثنين وحتى السبت، ومن 8 صباحا إلى 9 مساء يوم الأحد. تقع الأسواق على 32839 نورث ويسترن هايوي في مدينة فارمينغتون هيلز. لحوم حلال للجالية الإسلامية. لطلباتكم من المطعم كول 248-538-7855. That is 248-538-7855. قشة ميديترينيان ماركت، خدمة متميزة ومعاملة راقية.
Welcome back, and this is Khalil Hachem. We're talking to Dr. Suwan, and we're talking about the benefits from her trip to the Hajj, and the whole idea is how to deal with stress, how we can use faith and other elements to deal with stress.
There are other elements. I agree with you, Khalil. As a matter of fact, there are so many ways to deal with stress, and as I told you, we have to find out where the stress is coming from. And the 5 major stressors in life, I'll just, I will mention them so fast. I would say death of a loved one, especially if it is death of a child. The other stressor is, divorce. I mean, divorce is a huge stress on, both parties and on the children, whether they are young or adults. The other stressor is job loss. I mean, like when somebody would feel that they have no more, a steady income, or, there isn't like a routine of going to work every day. And, there are like so much involved into job loss as well. I mean, I think that we can talk about major stressors in one episode. The other thing that may cause stress would be moving. I mean, even if you are moving from a very small house to a mansion, still, it is stress because it is something that is breaking your routine, and it's breaking, I would say, it's breaking, your routine of finding what, where everything is, and at the same time breaking of your routine to have your, neighbors that you have been living with for some time. Also, I would say packing and unpacking. And if you are living out of state, you will start, making friends. I mean, this is like so much stress. Also, if there is a major illness, I mean, major illness is a huge stressor as well. Think about, if it's, like major illness is a threat to life, and at the same time, your loved ones would be involved emotionally and physically as well. They have, to take time out of work, to be, around, a sick person. And, also if the sickness is also, associated with disability, I mean, it's lots of stress on people who are involved and on their loved ones as well. There are so many causes that may cause, stress. I would say death, divorce, job loss, major illness, and moving. So, these are like the major stressors. So, I mean, there is stuff that we can control, and of course, there is something that we cannot control. So I would say that if we can control it, we can, but if we cannot, we have to live with it. Do you agree with me?
Absolutely. And it's easier said than done. It's not really easy. I mean, I talk about it sometimes, and conditioning and reconditioning ourselves to deal with stress, specifically when it is family-oriented and you're confronted with it every second. It's not that easy, And same thing when it is financial. There's no money, and the bills the bills keep coming. So it takes quite a bit of growth and conditioning to really deal with that stress.
I agree with you. And, to tell you the truth, like causes of stress are plenty. And, as I told you, if we want to start talking about them, we will not actually finish in one episode. There are so many. But I would say that, if we can control it, we can. And if we cannot, we have to live with it. The other thing that we have to be engaged in other stuff that we love. Like, for example, like doing charity, it may be very helpful. If I'm not happy, maybe if I will make somebody else happy, I will be happy. You know what I mean? And if I feel that I helped somebody, if I feel that, I was able and, like Allah made me a cause of helping somebody. I mean, this is just like an amazing thing. And, like so many people are enjoying this. You know what I mean? So I would say that.
Absolutely.
Yeah, if we are engaged in helping people. Okay.
Yeah. Do you think that? I would think that the family issues are even a bigger stress than outside issues, because if there is a good tight family with a lot of love and affection, they would get together, work together, lean on each other to confront the stress that's coming from the outside. However, when it's generated from the inside, it's much tougher to really confront, don't you think?
Of course. This is a very important point, and I would give you, like a very, very, very sound example, which is divorce. I mean, divorce is very emotionally, I would say draining. I mean, for the spouses and for the children. And, some people think that adult children are not involved because they are adults and they can manage their lives. But I mean, like it is so much. Think about somebody who has been living with mom and dad, like, for 30 years. And now, like, mom and dad are no more together. And God forbid, if dad is like, cheating or has infidelity issues, and now the dad is totally, gone from, like there is no respect to the dad anymore. And, like children will start questioning all of their life. I mean, was it real or was it, a lie from the very beginning? And then they have to deal now with the dad and his, like a new mistress or whatever. I mean, it's just like so much. I mean,
it is difficult. It is very difficult, And again, love is the key. True love and caring is the key. There is nothing better than, the family, friends, whatever circle there is, it seems like the best insurance really is to have that inner circle in which we can lean on at the time of stress and at the time where we need someone to be there for us.
Exactly.
Yeah.
But, if this is not the situation, I feel that, people, if something that they cannot control, they have to start, being engaged with other stuff. Charity work may have having, friends around, having a toolbox of techniques. For example, if I am under severe stress because I'm driving and there is lots of traffic and I decided just, to do some biofeedback, this may be helpful. This is just, this is one technique that I can use. But, if I am in a different situation, I may actually use something else. For example, if I have so much on my plate, I have to start, picking off stuff that is not needed to be on my plate. You know what I mean?
Exactly.
I would say, for example, a housewife who is engaged in so many activities with the kids, and then there isn't, any time for herself to breathe or to do anything else. Maybe, she should start actually thinking, okay, what is important and what is not important? Are these activities all necessary? And, if those activities are really wanted by the kids, or, they are actually wanted just to please her or to please dad. You know what I mean? So basically, maybe we should just, keep in our lives what is necessary and, remove what is not necessary. This
Absolutely.
is, one of the
and goes along with that is if something happens like divorce and whatever it is, the sooner you find a replacement and find love again, the quicker you're gonna heal. Unfortunately, in our community, community, it's tough to do that. But the sooner you move on and find love again, you're gonna feel better. Don't you think?
I agree with you, but I would give you an example. For example, if there is infidelity from one of the spouses, you cannot just tell the other spouse, okay, just go and find love again. What about, the kids who have, for example, no dad because dad is engaged with,
there's nothing you can do with that anymore, right? You can't repair it. Yeah,
I know, but for example, I'm just giving you an example.
I understand. It's not easy and it hurts, but you gotta move on,
I agree 100%, but the mom has to be a father and a mother at the same time, and then, just just to go and to be engaged in a very fast relationship that makes no sense and depriving the children, whether they are young or adults, from a mom.
We're gonna have to leave it. Yeah, we're gonna have to leave it to that since we're out of time. And these are really wonderful, wonderful tips, Dr. Suwan. We want to thank you for being with us on a Friday and the end of January. Have a wonderful, wonderful weekend. Thanks again for your wonderful suggestions.
Yeah, and then at the last, I want to say the most important thing is really praying, patience, and having faith in God. This is the most important.
Absolutely.
Okay,
thank you so much. We appreciate it. Thank you again for spending an hour with us. We really appreciate it. Have a wonderful, wonderful weekend. This is Khalil Hachem. Bye now.